Question 1. You are asked to measure how long a client engages in tantrum behavior. Which measurement method would be most appropriate? A. Frequency. B. Duration. C. Latency. D. Partial interval. Answer: B. Duration. This question is asking about the best way to measure how long a behavior happens. The key phrase here is how long. Duration is the measurement that records the amount of time a behavior occurs from start to finish. Frequency just counts how many times it happens. Latency measures the time between a direction and the start of the behavior, and interval methods record if a behavior happens within a specific time block. Since the goal is to know the total time spent tantruming, duration is the perfect fit. Imagine using a stopwatch. You'd start it when the tantrum begins and stop it when it ends to get the duration. So, when you need to know how long something lasts, think duration. Question 2. Your supervisor asks you to take ABC data on a client's hitting behavior. What does the A in ABC data stand for? A. Action. B. Analysis. C. Antecedent. D. Avoidance. Answer: C. Antecedent. This question is about understanding the different parts of an ABC data collection system, which is a way to understand why a behavior might be happening. ABC stands for antecedent, behavior, and consequence. The A specifically refers to the antecedent, which is what happened right before the behavior occurred. It's like looking for the trigger or the situation leading up to the behavior. The B is the behavior itself, what the client did, and the C is the consequence, what happened right after the behavior. So, whenever you hear ABC data, remember A is for antecedent, what happened immediately before the behavior. Question 3. When implementing a behavior reduction plan that involves extinction, it is important to expect a temporary increase in the behavior before it starts to decrease. What is this temporary increase called? A. Spontaneous recovery. B. Generalization. C. Extinction burst. D. Discrimination. Answer: C. Extinction burst. This question tests your knowledge of what can happen when you stop providing reinforcement for a previously reinforced behavior, extinction. The crucial part is the temporary increase in the behavior, when you stop giving the child attention for whining, which used to get attention. The whining might get louder or happen more often at first. This spike is called an extinction burst. Spontaneous recovery is when the behavior pops up again later after it seemed gone. Generalization is performing a skill in new places or with new people, and discrimination is knowing the difference between things. The key takeaway here is that an extinction burst is a normal, temporary reaction to extinction. Don't give up too soon. Question 4. An RBT is working on a skill acquisition goal with a client. The client is learning to identify different colors. The RBT holds up a red card and says, "Point to red." This is an example of A. Shaping. B. Naturalistic teaching. C. Discrete trial training, DTT. D. Chaining. Answer: C. Discrete trial training, DTT. This question describes a common teaching method. The key clues are the structured one-on-one instruction. The RBT gives a clear instruction, point to red, waits for the response, and would then provide a consequence, like praise or a reinforcer if correct. This highly structured approach, often done at a table or in a controlled setting, is characteristic of discrete trial training. DTT. Shaping involves reinforcing closer and closer approximations to a target behavior. Naturalistic teaching uses the client's natural environment and motivation, and chaining breaks a complex task into smaller steps. DTT is often used for teaching foundational skills in a structured way. Think of DTT as teaching in small, clear, quick steps. Question 5. When collecting data on a client's behavior, it is important to A. Only record behaviors that are problematic. B. Record data whenever you have free time. C. Be objective and record exactly what you see and hear. D. Only record behaviors that the client wants you to record. Answer C. Be objective and record exactly what you see and hear. This question is about the fundamental principle of collecting data in ABA. The core idea is objectivity. You need to record facts, not opinions or interpretations. The phrase objective and record exactly what you see and hear captures this perfectly. You shouldn't just focus on negative behaviors, wait until later to record, or let the client decide what you record. Good data is accurate data, and accurate data comes from observing and recording without bias. This helps your supervisor make informed decisions about the client's plan. Think of yourself as a scientific observer. Just report the facts. Question 6. Your client is learning to brush their teeth independently. Your supervisor has broken the skill down into smaller, manageable steps. Example, turn on water, wet brush, add toothpaste. This process is called A. Generalization, B. Task analysis, C. Discrimination, D. Shaping. Answer B. Task analysis. This question describes a strategy used to teach complex skills. The key clue is breaking down a skill into smaller, manageable steps. This is the definition of a task analysis. You take a larger task, like brushing teeth, and list all the little actions needed to complete it in order. Generalization is doing the skill in new situations. Discrimination is telling things apart. And shaping is gradually building a behavior by reinforcing approximations. A task analysis is like creating a step-by-step recipe for a skill, which makes it much easier to teach and learn. Question 7. A client is learning to say ball when shown a picture of a ball. The RBT holds up the picture and prompts the client by saying B. What type of prompt is the RBT using? A. Physical prompt, B. Gesture prompt, C. Model prompt, D. Echoic prompt, verbal prompt. Answer D. Echoic prompt, verbal prompt. This question asks you to identify a specific type of help given to a client. The clue here is the RBT saying B, which is a vocal sound intended to help the client say the word ball. An echoic prompt is a type of verbal prompt where you say part of or the whole word you want the client to say. A physical prompt is guiding the client's body. A gesture prompt is pointing or making a motion. And a model prompt is showing the client exactly what to do. Since the RBT is using spoken sound, it's a verbal prompt, specifically an echoic prompt, because they are providing a sound for the client to imitate. Prompting is about giving the right amount of help to ensure success. Question 8. An RBT is working with a client who loves cars. When teaching colors, the RBT uses toy cars of different colors. When teaching numbers, they count toy cars. This is an example of using A. Punishment, B. Extinction, C. Reinforcers or preferred items, D. The differential reinforcement. Answer C. Reinforcers or preferred items. This question highlights a common strategy in ABA to make learning more motivating. The core idea is using things the client likes to make activities more engaging or rewarding. Toy cars, which the client loves, are being used as the teaching materials and likely as potential rewards for correct responses. These items are acting as reinforcers, or at least highly preferred items, that increase engagement and motivation. Punishment decreases behavior, extinction stops reinforcement, and differential reinforcement involves reinforcing one behavior while putting another on extinction. Using what a client loves helps make learning fun and effective. Question 9. You are working with a client and they begin to engage in a challenging behavior. According to your client's behavior plan, you should withhold attention when this behavior occurs. This strategy is an example of A. Positive reinforcement, B. Punishment, C. Extinction, D. Shaping. Answer C. Extinction. This question describes a specific behavior reduction strategy. The key action is to withhold attention from a behavior that was previously receiving attention. This is the principle of extinction. You stop providing the reinforcement that was maintaining the behavior. If the behavior was happening because it gained attention and you now stop giving attention, the behavior should decrease over time. Positive reinforcement adds something to increase a behavior, punishment adds or removes something to decrease a behavior, and shaping involves reinforcing approximations. Withholding the usual payoff for a behavior is how extinction works. Question 10. An RBT is asked to gather information about a client's interests and potential motivators. Which assessment is designed for this purpose? A. Functional behavior assessment. B. Skills assessment. C. Preference assessment. D. Probing. Answer: C. Preference assessment. This question directly asks about finding out what a client likes. The keywords are interests and potential motivators. A preference assessment is exactly what it sounds like, a way to figure out what items, activities, or social interactions a client prefers. This is super important because knowing what a client likes helps you choose effective reinforcers, which are things that motivate them to learn and use new skills. A functional behavior assessment looks at why a behavior happens. A skills assessment checks what the client can do, and probing tests if a skill is already learned. If you need to find out what a client likes, you do a preference assessment. Question 11. You are teaching a client to wash their hands. You start by helping them do every step except the last one, drying hands, and you prompt them to do that step independently. Once they master drying, you help with all steps except the last two, drying and rinsing, and so on. This method is called A. Forward chaining, B. Backward chaining, C. Total task chaining, D. Shaping. Answer: B. Backward chaining. This question describes a specific way to teach a sequence of steps known as a chain. The key is that you are teaching the steps in reverse order, starting by having the client do the last step independently while you help with the rest. As they master the last step, you have them do the second to last step independently as well, and so on, until they can do the first step too. Forward chaining starts by teaching the first step first, and total task chaining teaches all steps simultaneously with varying levels of help. Backward chaining is helpful because the client finishes the task successfully on their own right away, which can be really motivating. Question 12. When providing reinforcement to a client, it is important to A. Always use the same reinforcer. B. Deliver the reinforcer immediately after the desired behavior. C. Only provide reinforcement after many instances of the behavior. D. Let the client access the reinforcer whenever they want. Answer: B. Deliver the reinforcer immediately after the desired behavior. This question is about the principles of delivering reinforcement effectively. For reinforcement to be most impactful, especially when a client is learning a new skill or behavior, it needs to be delivered quickly after the desired action occurs. This helps the client understand exactly which behavior earned the reward. Delaying reinforcement can be confusing and less effective. Using the same reinforcer constantly might lead to the client getting tired of it. Satiation. You shouldn't wait for many behaviors when teaching new ones. Start frequent. And letting them have it anytime means it's not contingent on the desired behavior. Immediate reinforcement makes the connection clear. Question 13. The RBT's primary role is to A. Design behavior intervention plans, B. Conduct functional behavior assessments, C. Implement skill acquisition and behavior reduction plans developed by a supervisor, D. Supervise other RBTs. Answer: C. Implement skill acquisition and behavior reduction plans developed by a supervisor. This question clarifies the main responsibility of an RBT. RBTs are frontline implementers. They work directly with clients, following the detailed plans created by a board-certified behavior analyst, BCBA, or other qualified supervisor. RBTs do not design the plans, conduct the complex assessments like FBAs, though they gather data for them or supervise other RBTs. Their crucial role is to consistently and accurately carry out the strategies outlined in the client's behavior plan. Think of the RBT as the skilled technician who puts the supervisor's plan into action. Question 14. Your supervisor tells you to use a DRO procedure for a client who frequently talks out in class. What does DRO stand for? A. Differential reinforcement of other behavior. B. Differential reinforcement of opposite behavior. C. Differential reinforcement of on-task behavior. D. Differential reinforcement of object manipulation. Answer: A. Differential reinforcement of other behavior. This question asks you to identify an abbreviation for a type of differential reinforcement. DRO stands for differential reinforcement of other behavior. In a DRO procedure, you provide reinforcement if the challenging behavior does not occur for a specific amount of time. You are reinforcing the absence of the target behavior or reinforcing any other behavior besides the target one during that interval. It's a way to decrease a behavior by rewarding the client when they aren't doing it. The other options are not standard ABA terms for this procedure. Remember, DRO means rewarding the client for not doing the behavior you want to decrease. Question 15. You are collecting frequency data on a client's hitting behavior. The behavior occurs, you mark it down. It occurs again, you mark it down again. What are you counting? A. The number of times the behavior happens. B. How long the behavior lasts. C. How quickly the behavior happens after a direction. D. Whether the behavior happens during interval. Answer: A. The number of times the behavior happens. This question is asking about the core purpose of frequency recording. Frequency simply means counting how many times a specific behavior occurs within a given observation period. The description, you mark it down again, illustrates this simple counting process. Duration is about how long. Latency is about the time between a cue and the behavior starting, and interval recording looks at whether the behavior happens at all during set time blocks. Frequency is the straightforward count, like counting how many times someone claps. Question 16. Which of the following is a major ethical no-no for an RBT? A. Documenting session notes accurately. B. Maintaining professional boundaries with a client's family. C. Accepting a large gift from a client's parent. D. Communicating regularly with your supervisor. Answer: C. Accepting a large gift from a client's parent. This question is about RBT professional and ethical conduct. Maintaining professional boundaries is absolutely critical. Accepting gifts, especially large ones, from clients or their families can create a dual relationship or blur professional boundaries, which can compromise objectivity and the professional nature of the service. Documenting accurately, maintaining boundaries, and communicating with your supervisor are all required and ethical actions. Giving or receiving gifts often falls into the category of things to avoid to keep the relationship strictly professional. Question 17. An RBT is trying to teach a client to respond to the instruction "sit down" only when given by the RBT, not by just anyone in the room. This is an example of working on A. Generalization. B. Maintenance. C. Discrimination. D. Shaping. Answer: C. Discrimination. This question describes the process of teaching a client to respond differently to different stimuli or cues. The core idea is the client learning to respond in a specific way only in the presence of a particular stimulus, the RBT giving the instruction, and not responding that way in the presence of other stimuli, anyone else giving the instruction. This is discrimination. Learning to tell the difference and respond appropriately. Generalization is doing the skill in new situations. Maintenance is keeping the skill over time, and shaping is building a new behavior gradually. Here, the focus is on responding only when the right person gives the cue. Question 18. You are working with a client who is learning to make a sandwich. You provide physical guidance for each step, gradually reducing the amount of help you give as they become more independent. This process of gradually reducing assistance is called A. Prompting, B. Fading, C. Reinforcement, D. Punishment. Answer B. Fading. This question asks about a strategy used after you've used prompts, help, to get a client to perform a skill. The crucial action is gradually reducing the amount of help. This systematic reduction of prompts is called fading. You want the client to perform the behavior independently, so you slowly lessen the prompts until they no longer need them. Prompting is giving the help in the first place. Reinforcement increases behavior, and punishment decreases behavior. Fading is essential to make sure the client isn't always dependent on your help. Question 19. A client previously learned to greet people by waving. Months later, without any recent practice, the client still waves when someone says hi or waves to them. This is an example of A. Generalization, B. Discrimination, C. Maintenance, D. Extinction. Answer C. Maintenance. This question is about a skill continuing to occur after it has been taught, and reinforcement might be less frequent. The key clue is months later. Without any recent practice, the client still waves. Maintenance refers to the ability of a client to perform a previously learned skill over time, even after direct instruction or frequent reinforcement has stopped. Generalization is performing the skill in new places or with new people. Discrimination is responding differently to different cues, and extinction is stopping reinforcement for a behavior. When a skill sticks over time, that's maintenance. Question 20. If a client engages in a challenging behavior and the consequence is that they escape from a non-preferred task, what is the likely function of the behavior? A. Attention, B. Tangible, C. Escape, D. Automatic. Answer C. Escape. This question is about the function, the purpose or payoff of a behavior. The direct clue is in the consequence described. They escape from a non-preferred task. If a behavior consistently results in the person getting out of doing something they don't want to do, the function is likely escape. Attention-seeking behaviors get a reaction from others. Tangible-seeking behaviors result in getting an item or activity, and automatic behaviors are internally reinforcing, like flapping hands because it feels goody. When a behavior helps someone avoid or get away from something, think escape. Question 21. You need to take data on a client's spitting behavior. You were instructed to record if the behavior occurs at any point during a 1-minute interval. Which measurement method is this? A. Frequency, B. Duration, C. Partial interval, D. Whole interval. Answer C. Partial interval. This question asks about a specific interval recording method. The critical phrase is record if the behavior occurs at any point during a 1-minute interval. In partial interval recording, you divide the observation time into short intervals, like 1 minute, and you mark if the behavior happens at all within that interval, even if it's just for a second. Whole interval recording requires the behavior to occur for the entire interval. Frequency counts occurrences, and duration measures how long. Partial interval is useful for behaviors that don't last long, but you want to know if they happen during a time block. Question 22. Which of the following is not within the scope of practice for an RBT? A. Implementing a feeding plan designed by a BCBA. B. Developing a behavior support plan for a new client. C. Collecting data on a client's vocalizations. D. Training a parent on how to implement a specific program step as directed by the supervisor. Answer B. Developing a behavior support plan for a new client. This question is about what an RBT is qualified and allowed to do. Remember, RBTs implement plans. They don't create them from scratch, especially complex ones like behavior support plans. Developing such a plan requires the expertise of a BCBA or BCABA. Implementing plans, collecting data, and even training stakeholders, like parents, on specific procedures under the direction of a supervisor are all typical RBT tasks. Creating the core plan is the supervisor's responsibility. Question 23. Your supervisor asks you to track how many times a client independently initiates a request for a break during a session. Which measurement method should you use? A. Duration. B. Latency. C. Frequency. D. Momentary time sampling. Answer. C. Frequency. This question is asking for the best way to measure the number of times a behavior happens. The key is how many times. Frequency is the simple count of how often a behavior occurs. Duration measures length of time, latency measures the time to start, and momentary time sampling checks if a behavior is happening at the very end of an interval. Since you just need to count each instance of the request, frequency is the most direct and appropriate method. Question 24. When communicating with your supervisor, it is important to A. Only report positive progress. B. Wait until your scheduled supervision meeting to mention any issues. C. Be objective and share all relevant information, both positive and negative. D. Make changes to the plan first, then tell your supervisor later. Answer. C. Be objective and share all relevant information, both positive and negative. This question focuses on effective communication with your supervisor. Your supervisor relies on you to provide an accurate picture of what's happening during sessions. This means reporting both the good things, progress, successes, and the challenging things, behaviors, difficulties, objectively and promptly. You should never hide information, delay reporting important issues, or make plan changes yourself. Open, honest, and complete communication is vital for your supervisor to guide you and the client's program effectively. Question 25. You are teaching a client to identify pictures of animals. You show them a picture of a dog and say, "What is it?" If they say dog, you give praise and a small treat. If they say something else or nothing, you don't reinforce and might try again later or with a prompt. This is an example of A. Punishment. B. Negative reinforcement. C. Differential reinforcement. D. Extinction. Answer. C. Differential reinforcement. This question describes a core principle in teaching and behavior reduction. The key idea is reinforcing one specific behavior, saying dog, while not reinforcing other behaviors, saying something else or nothing, in response to the same cue. This is differential reinforcement. You are reinforcing the desired response differently. By providing a reward, then you treat the undesired responses. By withholding the reward, punishment decreases behavior. Negative reinforcement increases behavior by removing something unpleasant, and extinction is simply stopping reinforcement for a behavior that was previously reinforced. Differential reinforcement helps the client learn which response is the right one to earn reinforcement. Question 26. An RBT is observing a client and records whether a target behavior is occurring at the very end of a predetermined interval, example, at the 30-second mark, then again at the 60-second mark, and so on. Which measurement method is this? A. Partial interval. B. Whole interval. C. Momentary time sampling. D. Duration. Answer. C. Momentary time sampling. This question describes another type of interval recording. The critical phrase is checking if the behavior is occurring at the very end of the interval. This is the defining characteristic of momentary time sampling. You set a timer and only record if the behavior is happening at the exact moment the timer goes off. Partial interval records if it happened any time during the interval, whole interval records if it happened for the whole interval, and duration measures total time. Momentary time sampling is like taking snapshots of the behavior's occurrence at specific moments in time. Question 27. Your supervisor tells you that a client's biting behavior is maintained by attention. During the next session, the client bites your arm. Based on the function, what might be the consequence strategy in the behavior plan? A. Give the client a preferred toy immediately. B. Briefly remove the client from the area. Time out. C. Ignore the biting behavior. Planned ignoring. D. Praise the client for biting. Answer C. Ignore the biting behavior. Planned ignoring. This question connects the identified function of a behavior, attention, to a potential consequence strategy to reduce it. If the biting behavior happens because it gets attention, then removing or withholding that attention is a common strategy based on extinction. Planned ignoring means you purposefully do not provide the attention, like talking, looking, or reacting strongly, that might be reinforcing the behavior. Giving a toy, tangible, using timeout, escape/punishment, depending on implementation. And praising biting would not be appropriate for an attention-maintained behavior. The key is to stop giving the behavior its payoff, in this case, attention. Question 28. When implementing a behavior reduction plan, it is important to A. Use punishment first to stop the behavior quickly. B. Use only one strategy at a time. C. Implement the plan exactly as written by the supervisor. D. Make adjustments based on how the client reacts that day. Answer C. Implement the plan exactly as written by the supervisor. This question emphasizes the RBT's role in implementing intervention plans. Your primary responsibility is fidelity, carrying out the plan precisely as it was designed by your supervisor. You do not have the authority or training to decide to use punishment first. Use only one strategy if the plan calls for multiple, or make adjustments on the fly. Any changes or concerns about the plan should be discussed with your supervisor. Consistency and accuracy in implementation are key to determining if the plan is effective. Question 29. An RBT is teaching a client to initiate social greetings. The RBT model saying hi and then prompts the client to imitate. When the client says hi, the RBT gives praise and a sticker. This is an example of using A. Punishment. B. Negative reinforcement. C. Positive reinforcement. D. Extinction. Answer C. Positive reinforcement. This question describes a basic learning principle. Positive reinforcement occurs when a desirable stimulus, something the client likes, like praise or a sticker, is added immediately following a behavior, and as a result, the behavior, saying hi, is more likely to happen again in the future. Punishment decreases behavior. Negative reinforcement increases behavior by removing something unpleasant, and extinction stops reinforcement. Adding a rewarding item or praise to increase a behavior is the definition of positive reinforcement. Question 30. You are taking duration data on how long a client engages in play with a specific toy. The client starts playing at 1:05 p.m. and stops at 1:12 p.m. What is the duration of the play behavior? A. 5 minutes. B. 7 minutes. C. 12 minutes. D. 1:05 p.m. Answer B. 7 minutes. This question tests your understanding of how to calculate duration. Duration is the total length of time a behavior occurs. To find the duration, you simply subtract the start time from the stop time. In this case, 1:12 p.m. minus 1:05 p.m. equals 7 minutes. The start time itself, 1:05 p.m., is not the duration, and 5 or 12 minutes are incorrect calculations. Calculating duration correctly means timing from when the behavior begins until it ends. Question 31. Which of the following is an example of maintaining client dignity? A. Talking about a client's challenging behaviors with your friends. B. Allowing the client to make choices whenever possible. C. Discussing client information in public places. D. Referring to the client using disrespectful language. Answer B. Allowing the client to make choices whenever possible. This question is about treating clients with respect and upholding their dignity. Maintaining client dignity involves treating them with respect, protecting their privacy, and honoring their autonomy when appropriate. Allowing clients to make choices shows respect for their preferences and promotes their independence, which upholds their dignity. Talking about clients inappropriately outside of the professional setting or using disrespectful language violates their privacy and dignity. Always treat your clients with the same respect and consideration you would want for yourself or a family member. Question 32. Generalization of a skill is important because it means the client can A. Perform the skill only in the exact setting where it was taught. B. Perform the skill with different people, in different places, or with different materials. C. Perform the skill correctly every single time. D. Learn new skills more slowly. Answer. B. Perform the skill with different people, in different places, or with different materials. This question focuses on the concept of generalization in skill acquisition. Generalization is the ability to use a learned skill in new and different situations from where it was originally taught. This is a crucial goal in ABA. You don't want a child to only say ball when shown a specific picture by one therapist in one room. You want them to say ball when they see a ball toy, a picture in a book, or say it to their parent or teacher. Performing the skill only in the original setting is lack of generalization. Generalization means the learning travels to new environments. Question 33. An RBT is working with a client on following instructions. The supervisor has indicated that the RBT should provide a highly preferred edible reinforcer, like a small piece of cracker, each time the client follows an instruction correctly. What schedule of reinforcement is being used? A. Variable ratio. B. Fixed interval. C. Continuous reinforcement, CRF. D. Fixed ratio. Answer. C. Continuous reinforcement, CRF. This question asks about different schedules for delivering reinforcement. The key clue is providing reinforcement each time the client performs the correct behavior. When a behavior is reinforced every single time it occurs, this is called continuous reinforcement, CRF. This schedule is most often used when teaching a new skill because it helps the learner quickly make the connection between the behavior and the reward. Ratio schedules involve reinforcing after a certain number of responses, and interval schedules involve reinforcing after a certain amount of time has passed. CRF is simply reinforcing every correct response. Question 34. You are writing session notes after working with a client. What type of information should you include? A. Your personal feelings about the session. B. Objective data collected during the session and a summary of activities. C. Gossip you heard about the client or family. D. Detailed opinions about why the client behaved in a certain way. Answer. B. Objective data collected during the session and a summary of activities. This question is about proper documentation for an RBT. Session notes should be factual and objective, reflecting what happened during the session. This includes the specific data you collected, like frequency counts or duration, a summary of the programs worked on and the client's engagement, and any significant observations or events, all described factually. Your personal feelings, gossip, or subjective opinions about the reasons for behavior should not be included. Notes are professional records used for clinical purposes, so stick to the observable facts. Question 35. What is the primary purpose of a functional behavior assessment, FBA? A. To teach a client new skills. B. To identify the function or purpose of a challenging behavior. C. To measure the duration of a behavior. D. To create a list of preferred items for a client. Answer. B. To identify the function or purpose of a challenging behavior. This question asks about the main goal of an FBA. A functional behavior assessment is a process used to understand why a challenging behavior is happening. It aims to identify the function of the behavior. What is the consequence that is maintaining it? Example: attention, escape, tangible, automatic. While FBAs inform skill teaching and behavior reduction plans, their primary purpose is diagnostic. to figure out the behavior's purpose from the client's perspective. Measuring duration is one data method, and finding preferences is a separate assessment. Preference assessment. An FBA is like being a detective to understand the why behind a behavior. Question 36. You are working with a client who needs to learn to stand up from their chair when their name is called. You initially provide full physical guidance, then less physical guidance, then just a light touch, then just a gesture, and finally fade all prompts. This is an example of A. Discrimination training. B. Shaping. C. Prompt fading. D. Chaining. Answer C. Prompt fading. This question describes the systematic reduction of help provided to a client. The phrase gradually reducing the amount of help you give by changing prompt types, full physical to gesture to none, is a clear example of prompt fading. You are systematically decreasing the level of assistance needed for the client to perform the behavior independently. Discrimination training teaches different responses to different stimuli. Shaping builds a behavior through reinforcing approximations, and chaining breaks down a task into steps. When you are lessening the prompts, you are fading them out. Question 37. An RBT is working on teaching a client to ask for a toy car. The client says car, and the RBT immediately gives them the toy car. This consequence makes the client more likely to say car in the future when they want the toy. This is an example of A. Punishment. B. Negative reinforcement. C. Positive reinforcement. D. Extinction. Answer C. Positive reinforcement. This question illustrates the concept of positive reinforcement in action. The behavior is saying car. The consequence is receiving a desirable item, the toy car. Because getting the toy makes the behavior of saying car more likely in the future when the client wants the toy, this is positive reinforcement. Something desirable, the toy, was added and the behavior increased. Punishment decreases behavior. Negative reinforcement increases behavior by removing something unpleasant, and extinction stops reinforcement for a previously reinforced behavior. Giving a preferred item contingent on a response is a classic example of positive reinforcement. Question 38. Confidentiality is a critical ethical standard. Which of the following actions violates client confidentiality? A. Discussing a client's progress with their parent. B. Leaving a client's paper data sheet visible on a table in a public waiting room. C. Talking with your supervisor about a client's challenging behavior. D. Reviewing client notes in a private office. Answer B. Leaving a client's paper data sheet visible on a table in a public waiting room. This question is about protecting a client's private information. Confidentiality means keeping client information secret and only sharing it with authorized people involved in their care in appropriate settings. Leaving data sheets or any client information where others can see it, especially in a public place, is a serious breach of confidentiality. Discussing progress with a parent, part of the team, talking to your supervisor, required communication, and reviewing notes privately are all appropriate actions that maintain confidentiality. Always be mindful of where client information is and who can see or hear it. Question 39. An RBT is tracking how often a client makes eye contact when their name is called. They count each time eye contact occurs. Which measurement method is being used? A. Duration. B. Latency. C. Frequency. D. Interval recording. Answer C. Frequency. This question is asking how to measure the count of a specific behavior. The phrase, they count each time eye contact occurs, tells you exactly what they are doing, counting instances. This is frequency recording. Duration measures how long, latency measures time to start, and interval recording notes if a behavior happens within set time blocks. Counting individual occurrences of a discrete behavior is the definition of frequency. Question 40. When teaching a new skill using discrete trial training, DTT, which of the following is typically the first step in the trial sequence? A. Delivering reinforcement. B. Providing a prompt. C. Presenting the discriminative stimulus. STI. D. Recording data. Answer. C. Presenting the discriminative stimulus. STI. This question is about the typical structure of a discrete trial training. DTT. Trial. A DTT trial follows a specific sequence. First, you present the instruction or cue, which is called the discriminative stimulus, STI, for example, holding up a picture and saying, "What is it?" Then comes the client's response, followed by consequence, reinforcement or correction/no reinforcement, and finally, the intertrial interval, a short pause before the next trial. Providing a prompt might happen after the SD, but the SD comes first. Reinforcement happens after the response, and data is usually recorded during or immediately after the trial. The SD signals that reinforcement is available for a specific response. Question 41. An RBT is working with a client who bites their hand when they are bored. The behavior plan involves providing engaging activities and attention contingent on a client not biting their hand for a period of time. This is an example of A. Punishment. B. Extinction. C. Differential reinforcement of other behavior. D. Differential reinforcement of alternative behavior. 3. Answer. C. Differential reinforcement of other behavior. D. This question describes a specific type of differential reinforcement procedure. The clue is reinforcing the client for not engaging in the target behavior, biting their hand, for a certain amount of time. This is the definition of differential reinforcement of other behavior. D. You are reinforcing any other behavior, or the absence of the target behavior, during that interval. D reinforces a specific alternative behavior that is incompatible or an appropriate replacement. Punishment decreases behavior, and extinction stops reinforcement for the target behavior. D is about rewarding the client for simply not doing the unwanted behavior. Question 42. You are asked to take data on how quickly a client responds to your instruction, touch nose. You start a timer when you say touch nose, and stop it when the client touches their nose. Which measurement method is this? A. Duration. B. Latency. C. Frequency. D. Whole interval. Answer. B. Latency. This question asks about measuring the time between a cue and the start of a behavior. The descriptions start a timer when you say touch nose, and stop it when the client touches their nose perfectly matches the definition of latency. Latency is the time that passes from the presentation of a stimulus, like an instruction, to the initiation of a response. Duration is the length of the behavior itself, frequency is the count, and whole interval is about if the behavior occurs for the entire interval. Measuring how long it takes for a response to start after a cue is latency. Question 43. If a client's behavior is maintained by access to toys, tangible items, what might be a consequence to reduce the behavior using a punishment procedure? A. Ignore the behavior. B. Provide a preferred activity. C. Briefly remove the toy. Time out from tangible. D. Give the client more toys. Answer. C. Briefly remove the toy. Time out from tangible. This question asks about a potential punishment strategy linked to the function of a behavior, tangible access. If the behavior is happening because it results in getting or keeping toys, then removing the toy contingent on the behavior could serve as a punishment procedure to decrease it. This is sometimes called time out from tangible. Ignoring would be for attention seeking, providing a preferred activity is typically reinforcement, and giving more toys would reinforce the behavior, not punish it. For tangible maintained behavior, a punishment might involve losing access to the tangible. Question 44. Which of the following is an example of objective language you would use in documentation or communication with your supervisor? A. The client was being bad today. B. The client seemed frustrated. C. The client cried for 5 minutes and hit their head 3 times. D. I think the client was trying to get my attention. Answer C. The client cried for 5 minutes and hit their head 3 times. This question is about using objective language when describing behavior. Objective language is based on observable facts that anyone could witness. Options A, B, and D are subjective interpretations or judgments. Bad, seemed frustrated, I think. Option C describes specific measurable actions, crying, with a duration 5 minutes, and a count, hit their head 3 times. This is objective because you can see and measure it. Always strive to describe behavior using clear, factual terms in your notes and reports. Question 45. An RBT is working on teaching a client to wash their hands by guiding them through each step from start to finish every time, gradually reducing help as they learn. This method is called A. Forward chaining, B. Backward chaining, C. Total task chaining, D. Shaping. Answer C. Total task chaining. This question describes another method of teaching a chain of steps. The key is that the RBT is working on every step of the task chain, through each step from start to finish, in every learning opportunity, providing prompts and support as needed for each step. This is total task chaining. Forward chaining teaches the first step first, and backward chaining teaches the last step first. Total task allows the learner to practice the entire sequence each time, which can be effective for some learners. Question 46. Your supervisor asks you to ensure a skill the client has learned, like saying hello, happens not just with you, but also with their parents and teachers. This is working on A. Discrimination, B. Maintenance, C. Generalization, D. Shaping. Answer C. Generalization. This question is about getting a skill to occur in different situations. The goal is for the client to perform the skill, saying hello, with different people, parents, teachers, than just the RBT. This is an example of generalization, applying a learned skill across different people, places, or materials that weren't part of the original teaching. Discrimination is learning to respond differently to different cues, maintenance is the skill sticking over time, and shaping is building a new behavior gradually. Generalization is about the skill spreading to new, relevant situations. Question 47. When reinforcing a client's behavior, it's important to consider the principle of motivating operations. MOs. What do MOs do? A. Signal that reinforcement is available. B. Make a reinforcer more or less effective. C. Are a type of punishment. D. Are the consequence of a behavior. Answer B. Make a reinforcer more or less effective. This question introduces the concept of motivating operations, MOs, also sometimes called establishing operations, EOs. MOs are factors that affect how much a person wants a reinforcer at a particular time, thereby influencing the likelihood of behaviors that have led to that reinforcer in the past. For example, being hungry makes food a more effective reinforcer. Being bored might make attention or toys more valuable. MOs don't signal reinforcement, that's the STI, aren't punishment, and aren't consequences. They happen before the behavior and make the reinforcer more or less powerful. Think of MOs as influencing motivation and the value of rewards. Question 48. An RBT is asked to use a type of interval recording where they record the behavior only if it occurs continuously for the entire duration of the interval. Which method is this? A. Partial interval. B. Whole interval. C. Momentary time sampling. D. Frequency. Answer B. Whole interval. This question asks about another type of interval recording. The key requirement here is that the behavior must occur continuously for the entire duration of the interval for it to be marked as occurring. This is the definition of whole interval recording. Partial interval records if it happens anytime, momentary time sampling checks only at the end, and frequency counts occurrences. Whole interval is often used for behaviors you want to increase, like staying on task, because you are reinforcing the behavior for lasting through the whole time block. Question 49. What should you do if a client's behavior plan includes a procedure that you are not trained or competent to implement? A. Try to implement it anyway to avoid disappointing your supervisor. B. Ask a colleague to do that part of the session for you. C. Inform your supervisor immediately that you need training or clarification. D. Skip that part of the plan and work on other goals. Answer. C. Inform your supervisor immediately that you need training or clarification. This question addresses an important ethical responsibility of an RBT, working within your scope of competence. If you are given a task or procedure you don't understand or haven't been trained on, you must communicate this to your supervisor right away. It is unethical and potentially harmful to try to implement something you are not competent to do. You cannot ask a colleague to take over or simply skip parts of the plan. Your supervisor is responsible for ensuring you are trained and supported to implement the plan correctly and safely. Always ask for help if you are unsure. Question 50. An RBT is teaching a client to build a block tower. The RBT praises the client for placing one block, then 2 blocks, then 3 blocks, gradually requiring more blocks before giving praise, getting closer to the goal of building a tall tower. This is an example of A. Chaining, B. Discrimination, C. Shaping, D. Prompting. Answer. C. Shaping. This question describes the process of gradually teaching a new behavior by reinforcing steps or approximations that get closer and closer to the desired final behavior. The client is reinforced for placing 1 block, then a behavior that is closer to the goal, placing 2 blocks, is reinforced, and so on. This gradual process of reinforcing closer approximations is called shaping. Chaining breaks a task into discrete steps, discrimination is learning to respond to different cues, and prompting is providing assistance. Shaping is used when the client doesn't currently perform the target behavior at all, and you build it bit by bit.